Good morning, everyone. My name is Simone Parker, and I'm with our CalPERS Stakeholder Relation team. It's our privilege today to host the town hall and introduce your representative on the CalPERS board, Yvonne Walker. Before I do that, I'd like to explain the format of this webinar. It's simple. Yvonne will provide some updates on CalPERS. Following her remarks, we'll take any questions as time permits. If you have questions when it comes time, you can raise your virtual hand and we'll call on you. You can access this feature by clicking the raise hand icon in the toolbar at the bottom of your screen. Once we call on you, you can click the microphone to unmute. And if you need accommodations because you're unable to raise your virtual hand to ask a question, please send a message in the Q&A so one of our moderators can assist you. If you need closed captioning, you can click the Show Captions button on the toolbar for that feature. As a reminder, this webinar is being recorded and will be posted on our YouTube page next week. If you want to be automatically notified that the video has been uploaded, you can subscribe to our CalPERS YouTube channel. We have an hour together, so I want to make the best of our time together. So with that, I'm pleased to introduce Yvonne Walker. She's serving her first term on our board. Yvonne has served California and our nation for more than 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and veteran. Please join me in welcoming Yvonne Walker.
Hey guys, how are you doing? I'm just going to jump right in. So hopefully we'll have more time at the end because I want to do some other updates then. Okay, so it's really good to see all of you today. Well, it's really good to be here with all of you because I can't actually see you. So in October, our leadership team provided a state of the system update to employers in attendance at our annual educational forum. We all know that when it comes to CalPERS, members care about knowing that their retirement is secure and also their health care is provided. They want to make sure that the premiums don't go up too high and they can continue to see their doctor or find a new one if they need to. So I have good news to share with you today on both fronts. So let's talk about the health of the fund. In July, CalPERS announced a one-year investment return of 11.6%, and this figure comfortably beats the 6.8% rate of return that we set as a target. When we get returns like this, what it means is that our unfunded liability goes down. And that's good news for employers who over time will also see their contributions go down as a direct result. I know, and I've heard this from some of you that say, you know what, we should only invest passively in index funds. But I will tell you that's not how we achieve this return. And the board does not believe that that is a way to maximize returns in the future. Publicly traded stocks had the highest return last year at 16.8%, but the second highest performing category was private equity. These investments brought in a return of 14.3%. Investing in the private markets gives CalPERS the opportunity to use its expertise and market clout to get good return from investment partners and find new and exciting opportunities that are not available on public exchanges. The 11.6 return last year raised our funded status to 79%, which is a 4-point increase over last year. Research organizations that track public pension funds say those in the US are 75% to 80% on average, right? So we're doing really good. But our goal still remains to get to 100% funded, and we are pursuing a variety of strategies to meet that goal. So let me tell you about one of the strategies that we're looking at. First off, we're taking a hard look at our investment approach to make sure it is the right one for today's market. We're looking for the formula that will produce the highest returns while staying at a level of risk that we as members of the board are comfortable with as the stewards of your pension dollars. We go through this process every 4 years, and it also involves looking at how much we expect to be paying out in the future, and based on when people are retiring and how long they are collecting benefits. Our Chief Investment Officer, Stephen Gilmore, has proposed that we adopt a holistic approach to investing called a total portfolio approach. It's a strategy that has worked well for several institutional funds around the globe. Traditionally, our approach has been siloed by categories. We decide we're going to invest X amount in X category of investment and hire managers who focus exclusively on that category. Total portfolio is a little more flexible approach that has managers of different types of investments working to pick the most attractive investments for the portfolio at any given time, regardless of the type. The whole investment team is then focused on the returns of the whole portfolio, not just their own individual piece. A very important part of the equation that the board is working through is to determine the level of risk we are willing to take if we move in this direction. Our team is creating an index, which is a basket of traditional stocks and bonds that we can track, so we can see how if we take the total portfolio approach, how it performs in comparison. Myself and the other board members will be deciding at our meeting next week whether to go with this approach. So we'll follow up on that decision by communicating through our website and email to our members. Now let's talk about healthcare for a while. So this year we saw an overall premium rate increase of 8%, with HMOs at 6% and Medicare plans at 10.78%. Medicare costs are being impacted by changes in funding coming from the federal government and higher usage of medical services for both Medicare Advantage and Medicare supplemental plans. Healthcare cost increases are always a challenge for members and, for CalPERS as an institution as well. There are things we can do as a large healthcare purchaser to contain rates. And then there are things beyond our control, such as Medicare changes from the federal government. What we can and have been doing to manage health premium rates is to take advantage of the negotiation process when we renew our 5-year health plan contracts with our HMO and PPO plans. And most recently, we just selected a new pharmacy benefits managers. And I will say these are some of the healthiest, some of the strongest healthcare contracts in the country. In them, the healthcare plans have agreed to pay us a hefty surcharge if they fail to meet targets for keeping premiums down and improving the health of our members. The same goes for our new pharmacy benefits provider. On the other hand, the health plans will be rewarded if they meet health improvement measures for the top 5 most common conditions like diabetes, hypertension, and childhood immunizations. And we hope that these contracts will serve as a model for other healthcare purchasers across the country so that collectively, purchasers have more leverage in future negotiations. The new pharmacy benefit manager contract goes into effect starting on January 1 and will affect all health plan members except those enrolled in any of the Kaiser or Blue Shield plans, as well as the Medicare Advantage plans for Sharp Direct and United Healthcare. Now, some of you may have received a letter in October saying you will be disenrolled from Optum RX. Don't worry, you'll not be losing any benefits. You'll automatically be enrolled in the CVS plan. And if you're a Medicare member, you'll be enrolled in the CVS Silver Script program. If you're wondering, and you'll receive a welcome kit in December with your ID cards and information about using your benefits. Okay, and so for those of you who are wondering about vaccine availability, CalPERS and our health partners will continue to provide and cover this year's COVID-19 vaccines for all members 6 months of age and up, despite the federal government's changing guidance on the COVID-19 vaccine. And lastly, if you have been using or plan to use telehealth services, I just want you to be aware that some plans have discontinued coverage as of September 30th due to the government shutdown. Be sure to check with your health plan before seeking out these services. Okay, and so I just want to add a couple of things on the telehealth thing. Wait a minute, let me find the right thing. So the telehealth coverage, the Medicare telehealth coverage, some of those rules went into effect when we were in the pandemic, but as of September 30th, 2025, those temporary rules, they ended. And that's why they're not covering all of the telehealth services. Medicare still covers some, but the range of services is now narrower. And for CalPERS members enrolled in the Medicare supplement, this change reduced the types of telehealth services that are covered. So for members who are enrolled in Medicare Advantage plans, their telehealth coverage remains the same. So I would just say it's a good rule of thumb as you're looking to schedule telehealth appointments. I would call first and make sure that it's still covered, right, before doing it, so there won't be any surprises. And so that's some of the work that the teams are doing on the health of the fund and the health of our members. And I just want to just remind you of how you can stay on top of things that are happening at CalPERS. So, like in an effort to keep you abreast on important policy issues, we have started a series called CalPERS Now, and that gets emailed out, right? CalPERS, we're going to have a virtual class on December 9th at 9 a.m. designed just for retirees to get ready for 2026. It's called Retiree Insights, Staying Informed Together. And you can sign up to attend through your My CalPERS account at any time. And so the class will cover your pension, deductions, and designations, working after retirement, key dates and reminders for 2026, 1099-R tax statements, of course, and your cost of living adjustment, COLA. And so let me just shamelessly plug again, if you do not have a My CalPERS account, I encourage you, please get one. There's a lot of information on there that will be available for you. They have a lot of the webinars, that we do. They'll have links to it, like on our YouTube account or different things. And that's a good place to start. If you're saying, hey, I wonder if I can do this or do that, that's the best place to start first. And so just look at it, even if it's just once a month. All of the forms you would ever need are there, plus all kinds of helpful videos, webinars. They include forms for designating a person who has special power of attorney permission to make decisions about your CalPERS account, and the form for designating a beneficiary. And I'll say once again, it is important to have that special power of attorney in case you get incapacitated and you can't make decisions, and we can't automatically decide who we're going to deal with. So it's always better to take care of this stuff in advance, because you know what, life happens, and we want to be as prepared as we can. And if you're going to the website, you'll notice that we've started a big push to get every member to sign up for a My CalPERS account. So if you haven't done it, please do it. And another shameless plug, if you already have a special power of attorney, if you did it 5 years ago, 2 years ago, 10 years ago, I would just recommend, I tell everybody, once a year, you should go in and check to make sure that that's the beneficiary you want making decisions for you, because sometimes, again, life happens, things happen, maybe you're the person you designated, maybe they died, who knows? Or, maybe it was a kid who then went through some changes and they're not the right person for you anymore. So just different things like that. I always recommend that you check it out at least once a year to make sure that is the right person and the right thing. And also, I just want to remind you, you can always sign up to come to these wonderful, fantastic, fantabulous town halls that we do with each other to get the latest and greatest. I'm going to stop right here. I have some other stuff, but I want to make sure that we have time for any questions or comments. And so while you're queuing up, Simone, wait, before that, Simone's going to tell you how to queue up. And then while you're queuing up, I'm just going to answer some of the questions that I have gotten prior to the webinar. So go ahead, Simone.
You got it. So it looks like we do have about 10 people that have raised their hand. So again, there's a raise hand feature at the bottom of your screen that you can click. And when I call your name, if you can click the unmute button to come off mute and ask your question. But before we do that, Yvonne, if you wanted to do some of the questions that came in beforehand, go ahead.
Thank you. Okay. So Monica K asked, when can a CalPERS annuitant work part-time temporary assignments at a CalPERS agency? In the past, there is a 960 hours per fiscal year rule. That rule is still the same. You can do it. The rule has not changed. What it did do is it put in, I lost my word, I'm sorry, but the rule hasn't changed. But again, I would advise you to go onto the CalPERS website because they have a lot of Q&As there that I think will then make it a lot clearer for you. And then Jim Boone, you've asked, could I send information per CalPERS so I may know what I need to do and able to make the best decisions for our retirement plans? Again, I'm going to direct you back to the website, because they have videos up there, that you can watch, and they're going to have that one coming December 9th, I think I said. But also you can make appointments with the regional offices, right? And sit down and talk to folks. But, start with the website, call the 800 number, right? And that will be helpful. And then Hilario Luna asked us what we're doing to prepare for the large amount of questions, concerns about the Optum to CVS change on January 1st, because the last time when we did the healthcare, there was a lot of issues. And so we just wanted to make sure, how are we preparing for this? So I will say, we started as soon as the board made the decision that we were going to go with CVS. Our healthcare team started immediately, and this is in, I think it was August, started working with CVS, right? We took the lessons that we learned from when we switched our healthcare providers, right? To make this a lot more seamless. That's not to say that we're going to hit it 100% out the park, but we're working on it. I think it's going to be a lot smoother than it's been in the past. There are some formulary changes, and there are some existing prior authorizations, but you should be getting information in advance so that then you can, if you have to talk to your doctor about getting, a different prescription or something like that, that can be handled so that there's no interruption of care. So, and then one last one, I just want to thank, who was it? Oh, Duke Ackerman. You asked me, are members aware of Vanguard founder and president John Bogle's book, The Little Book of Common Sense Investments? He said it includes the index of widespread investing. Anyway, so no, I don't know if they're aware. I wasn't aware. I'm certainly going to look it up. So I appreciate the recommendation. And so Simone, let's go.
All righty. So it looks like Floyd, you are our first individual to ask your question. So go ahead and click the microphone and ask your question.
Yes.
Hi, Floyd.
Yes. How are you, Yvonne? I just wanted to know. I know I talked about this in May about my application being changed without me being involved, and I know it's way past that 30-day window that I had to change it. But is there anything that anything that I can do to try to make get this corrected? Is it really too late? Because I'm just a little concerned because I think the cost of living adjustment is going to be maybe 2%. I don't know what it is for CalPERS yet, because I know they haven't sent anything out, but I got a Social Security statement saying that the cost of living increase for them is 2.8%. So that would make a, you know, significant difference in what I get per month. So I don't know, is there, and you did respond to me, and
Mhm.
there was a staff member that had wrote something, and I responded back, and I don't know who the person was. I didn't want to, you know, uh,
I appreciate that. You don't want to out somebody on the webinar. I appreciate that.
yeah.
Yeah.
But anyway, do you know how what I can do? Is there anything I can do, or?
I don't know that there's anything that you can do. And here's the as I'm remembering, the challenge is that you set a date, right? But then what had happened was you as you're out, right? They didn't you were still on the books, and so you earn time while you're still on the books. And so that actually comes from your employer. It doesn't come from CalPERS, right? And so the place to correct that is at with the employer, and they have to do whatever it is that they do. But if I remember correctly, I don't think that there's anything further that we can do.
I see. Okay. Because I did um, try to go through the employer, but it was
Hard,
still, yeah, it was very hard. And
right?
still, I don't know who called CalPERS to change my application. See, I wasn't even involved.
Right.
And I would have, um, if there was an issue with the, being paid on a certain date, I would
You
have
would have made a
just,
different decision.
yes.
Yeah,
And
I
somebody
get
made a
that.
decision. Yeah, somebody made a decision for me.
Right.
That
And I will say, mine went, just for me personally, it went in the opposite direction where, I picked my date and everything else. And then turns out they had to change it because when I left, I was again still in the books, and they had to, so it was a different thing. It was not detrimental to me, I will say, but, the same. So it is not a unusual occurrence, but, I would be appreciative if they, for the employers, if they are a lot more forthcoming, with employees when they're, putting in their papers and retiring. And that's another reason why I always recommend for folks prior to you retiring, like if you're, I always say, if you're thinking about retiring, right? If you think about it in advance, you want to, go in with the regional office, schedule an appointment 5 years out, right? So that you can start planning it out, and then do it 1 year out just to make sure that you're on track and that you have you've checked all your boxes. And so that way, if your employer is not doing something, then, you can say, hey, look, I've got this checklist. I just want to make sure that we're on track. So, but I hate that this happened for you, Floyd.
okay? All right. Well, thank you. Appreciate your comments.
Okay.
Uh, that's all I have.
All right. Thanks, Floyd.
Thank you. Next, is it Wissam? Wysam? You can click the microphone. There you go.
Yeah. Good morning, Yvonne. Appreciate this webinar and your participation and all of that. I've talked to you before about transparency and why the Medicare price of the whether PERS Gold or PERS Platinum or even Kaiser and all of that, when you compare it on PERS, next year we're going to pay over $600. There are many plans outside for Medicare people that are from $0 to $300. And I ask that CalPERS people would compare side by side these plans and what's the advantage of CalPERS over the other one. I've been asking for this question for 5 years and I haven't been able to get any answer. You promised that you're going to have somebody from CalPERS to call me and nobody did.
And nobody, oh, they didn't?
They
Okay.
never did. And I talked to
Okay.
you in person on the phone also.
Absolutely. I remember the conversation, and I apologize if I had known that they didn't.
Yeah, and I sent you some of the
Yeah,
things
I
that are
remember.
available on the market also.
Yeah, I got that.
Yeah, so I don't know what is, are they
Give me
hiding
one more
something?
shot at this. Give me one more shot at this, and I'm going to have
Yeah,
somebody get back with you, okay?
yeah. Many of the people that on retirees, on CalPERS and all of that, they left the plan and they went on the market, and that's not good for CalPERS, because if most of the people, healthy people, will go out for the cheaper plan, and you're going to continue to increase your plan because your base is probably people with many more problems and many issues and so forth. So somebody need to look at it and make sense out of it.
Okay. All right. Give
And
me one more shot at this with them.
and you have my number. You can call me.
Yes.
We can chat
Yeah,
more. I
yeah.
appreciate your time.
Okay.
Thank you so much.
All right.
Thank you. Ryan, go ahead and come off mute and ask your question.
Is that it?
We got you, Ryan.
Okay. Hi, Yvonne. I have a question for you, I guess. I've been trying to contact you. I've sent you a few emails. I'm having problems with medical with Blue Shield. I have the CalPERS PPO plan, and I live out of state. I had a knee replacement in March, and prior to that, my doctor had told me that had sent me for like a nerve block type procedure, but he said, hey, you better make sure it's covered because some plans cover it and some plans don't. So I'm glad he told me that. So I called and tried to get with Blue Shield. I couldn't get with them. So I had to go through Included Health because that's the only people that we can talk to.
Right.
Went through Included Health. Long story short, before I had the procedure done, you always recommend making sure we cover our bases and make sure that
Absolutely.
that we get prior, and make sure things are covered. Well, Included Health told me this procedure was 100 would be covered. Actually told me how much my deductible would be, everything else. Now, 9 months later, I've been denied the procedure through Blue Shield. I appealed it through their appeals procedure. They denied it. Gone to the second level. They've denied it. I sent a package to CalPERS, to the Healthcare Compliance Division. They said they received it. Have never heard anything back from them, and I just need some help. I would never have had this procedure done had Included Health not told me that it was covered, and I do have it in writing that they did tell me.
Wonderful.
I took pictures of the chat that we had with Included Health, and I know CalPERS has hired Included Health to be your representative for service for Blue Shield. But if they're giving out false information, what good does it do us?
I don't know.
Because
Well, we don't know that it's false information. We don't know that it's Included Health that's the problem. But let me say, and I don't remember an email from you, Ryan. That doesn't mean you didn't send it. I just don't remember it.
Yeah, I sent a couple. I did send a couple of emails to you. I know you're real busy, but I just really need some help. As I know,
absolutely. Let me run this one by, and I will have somebody get back in touch with you.
Okay. Now I got a message from a Geraldo from CalPERS Compliance saying that they received my packet that I'd sent.
But that's not saying they received the packet. Does not. I mean, it's nice that they got it, but that's really not taking care of the problem.
And that's all I've gotten so far. All I've gotten is denials, and now the provider, who's been trying to comply with everything that they've been asking to do, is sending me a bill for almost $4,000 for this procedure. So,
ooh, Lord have mercy.
Yeah, and like I said, if Included Health had not told me that it was covered, I probably wouldn't have had it done.
Right. I get that. I get that.
It helped a lot with the recovery and my physical therapy after surgery, but
absolutely.
It's not helping me now 9 months down the road because
9 months and $4,000 later.
Yeah.
Let me
should I send you my number through like a chat or something like that, or maybe
That would be helpful. That would be helpful.
can I do it on the chat on the webinar here?
Well, if you do it on the chat on the webinar, everybody's going to see it.
Oh, okay. What about the contact center number that's listed under yours?
Yeah. If you do it, if you do it under there and just tell them, to get that number to me, they will. They'll forward it to me.
That's that 888 number. I could do that.
866 or something. Yes.
Okay. I will call that just as soon as we get off the phone then.
Okay.
I will
And
have
then I'll look for it and I'll make sure that I, move this along.
I would appreciate it because
Absolutely, Ryan. Yeah.
I kind of feel bad because I tried to do everything I could do to make sure things were covered.
Right. Don't feel bad. This isn't you. Don't feel bad. We're gonna get this worked out.
Well, that sounds great, Yvonne. Thank you very much. I'll call that number and I will send that information over to the person that that can get that to you. So
thanks, Ryan. Appreciate it.
Thank you so much for these webinars. We do appreciate them.
All right.
Bye-bye.
Joseph, go ahead and take yourself off mute and ask your question.
Okay, can you hear me?
Yes, Joseph, how are you today?
Good. How are you?
I'm good.
Okay, thank you very much for this webinar. It's this is my first one, and it's very informative. Okay, so my question has to do with the health insurance. I'm moved out of state, so I'm only offered like everybody else PERS PPO Platinum.
Platinum, right.
Okay, this year or next year it's going up $336 a month, so I'll be paying a total of $967, I believe, out of pocket. Okay, my concern is that, how much is it going to keep going up every year? Maybe I'm being a little excessive, but if I project these kind of numbers in 5 years from now, it could, if it continues the same, it could be $2,700 to $3,000 a month out of pocket for medical premiums. Am I being excessive on that, or is that a real possibility? Because who can stay retired at that point?
Yeah, that I don't know. I mean, I can't say that it's excessive. I can't say that it's not. Let me ask you something. Are you on Medicare?
No. My wife and I are still like, she's about 8 years off of Medicare. I'm about 11.
Ooh, that sucks.
Yeah,
it does. Sorry, that wasn't.
It does. No, I know. I agree.
Yeah, because that's where you get real relief when you.
Right, and that's the thing, like there's no other plans available. That's all we're offered. I think they're trying to they say something's in the works to try and change that. I tried PORAC, but they said I don't qualify for PORAC. That's some other peace officer union or something.
Right.
But like I'm just saying, I mean, this year for out-of-staters, it went up like 13.24 or something percent. If they do that every single year, monthly premiums out of pocket are going to be astronomical.
Right. No, I get it. I get it. So let me just tell you, and I'm just going to tell you what I've discovered as I'm working on this and everything else. And this has been, I will say, a challenge for a number of years, right? Even before becoming retired, when I was representing actives, right? Because to me, it seemed kind of simple, right? Like if we got Kaiser here, we got Kaiser out of state. I mean, the same health plans are across the country. Why couldn't we come to an agreement? But as I have found out, apparently that is not the way it works. And so while we have leverage here in California, right? So in order for us, say you lived in Texas and we were going to we'd have to reach some agreement with Texas, and they'd basically be doing us a favor. Right. And Texas doesn't like us that much. Right. There's nothing in it for them, I would say. Not that they don't like us. I'm sure they well, maybe not, but still. I just, so that's part of the challenge, because our leverage exists here, not nationwide. Right. And so just trying to figure it all out. And here's the other challenge, like there was some relief done, and this is not helpful to you, but just to paint the whole picture.
Right.
There was some relief done for actives, right? They were able to, negotiate, an additional supplement, right, with
Right.
the state, right?
Right. Right.
And that just passed. And so that, they got, but it's a little more challenging with retirees because a lot of the tax codes and everything else, they're not like, we can't have a health savings account, right?
Right. Right. Right.
Kind of thing. And so it's a little more challenging. It's not as simple as I originally thought. So I'm continuing to dig in, trying to see where or if,
Right.
something
Right.
can be done, have not been successful yet. And I'll be honest with you, until we get to, a national healthcare plan, I think this is going to be a problem.
Yeah, and I mean, I just don't know who can continue to pay these rising monthly premiums like this. Like if I lived in when I lived in California after I first retired, I wasn't paying anything a month because I was eligible for
So
HMO
190.
for Blue Shield. Yeah, so I mean that was it. I didn't pay anything because
Right.
whatever they covered was enough,
Right.
But because like basically I think they're covering, I think 2,000 something CalPERS because I'm eligible for the max. It's like $2,000 a month. So then I'm responsible for anything over that.
Right.
Which is like that next year 967. But like I said, I mean, if it's like almost like taking on a new car payment every year. And it's like who can do that? At some point something has to give. I don't know. I mean,
absolutely.
Nobody's going to be able to. I mean, eventually, I don't know. Maybe I'm being real excessive, but it's like people are going to be owing CalPERS because they won't even get enough per month to cover their monthly premium.
Oh yeah, you won't be owing CalPERS.
Okay,
No, I'm
okay.
kidding.
Yeah.
Yeah,
So,
but I will say, this is a bigger problem. I was talking to my daughter this morning, about her healthcare because open enrollment for her, same thing, and she's having to decide. And
Right.
Because her company is in Texas, so she's the out-of-state employee.
Right.
And
right.
so, she was going to have to pay, in excess of $2,000, right?
Right.
A month. And
right.
she was like, yeah, I can't do that. And I was like,
Right.
And so it's not an issue that is just us, here.
Right.
So, but I believe that it's something that has to be worked on because, I mean, this is crazy. This is crazy.
It's crazy. I could see it going up maybe $80-$100 a year, even like, if they were just to, if it would be a total wash with the COLA, I could see that. But this COLA won't even keep up with this kind of increase.
Absolutely. Absolutely. So this is just, so yeah. So I don't know.
Okay. All right. Well,
But
thanks.
Thanks, Joseph.
You're welcome.
Sorry, I didn't have better news. But
Sina, if you want to come off mute and ask your question.
Good morning.
hey,
For taking my question/comment. I proactively called CVS Caremark, who will be the new prescription provider when Optum expires. And although we're not paying a premium in order to now have this drug plan, the formulary is not the same.
no.
And I called up. I have a thyroid condition. It's very common. I take thyroid medication. I take a medication after many trials and errors that is the only medication that works for my condition. It's not covered at all. In fact, it will not be covered at all. In fact, the only medication that is going to be covered through CVS Caremark is going to be the very common Synthroid with the generic levothyroxine. In fact, it's only levothyroxine. Even Synthroid needs to have an exemption filed. In order to have anything else covered, you need to have your doctor file an exemption petition in order to have it approved. Not once a year, every time your prescription renews, is what I was told. No doctor is going to have well, maybe some would, but I'm going to have you consider that doctors spend enough time with trying to get their bills done and out to have to do this every single time a subscriber has to renew a subscription, prescription is outrageous. And I had a long conversation with someone at CalPERS because clearly this is cost containment at the expense of people who have chronic illnesses who have been covered under their prescriptions, under their health plan for God knows how many years, and now that's all changing. So when you say that there's good news that we're not going to be paying premiums, that's a little backhanded because we are in fact going to have to pay on the other end if our regular prescriptions are not being covered and we don't have any options. So I would like you to consider, I'm sure I'm not the only one that's been proactive in calling about the formulary changes, to go back to the table for the next time and understand that when you're on a fixed income as a senior retiree, that there aren't many options out there to then have to either beg your doctor to file an exemption and hope that you have it approved continuously, or have to pay out of pocket through a specialty drugstore in order to have your prescription ground. I've never been through this. I'm grateful that I have health care. Please don't get me wrong. I'm grateful for the coverage that I have through CalPERS, but I find that to contain costs through prescription savings for CalPERS is absolutely horrendous for the retiree and should never have happened this way as far as I'm concerned. And I appreciate it. I'm not going to stay on. I also was the person in the chat who asked that there be time limits on each person so as many people could have their issues covered as possible. Because when somebody drones on for 15 minutes and then time runs out, we don't get our questions. And that's happened to me twice. I've emailed you both times after the fact and never had a response. So I'm grateful to have you be able to take my question/concern today. And once again, I am very grateful for the coverage that I do receive from CalPERS, but I am an older person now and retired, and unfortunately have a chronic health condition that I need to have medication to in order to survive, basically.
Right.
So I'm hoping that CalPERS is going to consider their drug plan or coverage, formulary coverage in the future.
Yes, I will certainly bring that up. I understand what you're saying because I also am on for my maintenance drug. I have to get a new prescription every month, every single month. The new prescription, and you know, I get it. What you're talking about, Sina. So I've made a note. And just a reminder, for the ones that you've emailed me or it's in the chat, what we do is we take those and we put them all together by category and we send them out. I think it's like a couple of weeks after the webinar. Is that right, Simone?
Yeah,
Sorry.
it takes us a couple weeks. So
Yeah. So you might not get a direct response, but look on the when you get the email, look on that. And if it's not answered, then let us know and we'll, try something else.
Thank you.
Deb, you're up next. Go ahead and come off mute.
Hey, Deb.
Yes, good morning. Thank you. It's my understanding that CalPERS board process for answering member questions at public meetings or when we write the board, that these questions go to the CalPERS board service unit, and then they are the ones that answer the question, and we're supposed to receive them.
Yes.
Fortunately, for years, many members, such as myself, we've never heard back on our questions that we've sent to the board, or in some instances when people have made it public meetings, of course. So this leads me to a two-part question, Yvonne.
Okay.
What are you, as a board member, doing to ensure that members' questions are addressed by the board services unit and that we members will get an answer? How do we have any accountability or transparency on this? Because we
Right.
retirees are left in the lurch. And my second question, which also pertains to this, is that I was one of many people who sent an email to every board member asking them to please provide the justification for why we gave our CEO a huge salary bonus and increase in salary when CalPERS is underfunded at 79%. And incidentally, there are public employee systems that are funded currently at 100+%. And
Yes.
also, we have 150 billion in liabilities. We lag behind other public pension systems, and our premiums are ahead. They cost more than health inflation. How, therefore, does any of this justify a bonus and salary increase? I look forward to your answers to these two questions.
Okay, so I can, one I can answer just off the top of my head. When I get directed to me questions, I forward it on so that you can get, an answer from a subject matter expert, right? But then what I do try to make sure is that an answer is given. If not, then I will continue to push and make sure that an answer gets given. Sometimes it's not a perfect system. Sometimes, things, at least on my end, fall through the cracks and you might have to, goose me again. But that is my process, right? I can give you something, because for answers, I can give you something off the top of my head, but I want to make sure that you're getting the best information from the best source. So that's what I do. And as it relates to the executive compensation, that is a formula that was set long before I came on the board. Executive compensation, it is actually a formula that we track and that we follow. And so that's what we do. I mean,
Yvonne, I'm very aware of the formula, and I've also seen the different elements on a qualification chart. So forgive me, you're not really answering my questions. Number one, I still don't know what you're doing as a board member, not just for yourself, but for all of us. When we send questions to the board, we need you to know we're not getting answers. We have no way of knowing if the board services unit gets our questions because we're not getting any responses. And secondly, all I'm asking for is, since you folks approved the salary bonus and increase, what's the justification when we are having an underfunded system that isn't safe, 150 billion in liabilities, and all these other issues that don't sum up as something that is an exemplary performance? It's a simple question.
I gave you the answer that I have. I'm sorry that it's not acceptable, but I've given you the answer that I have. And here's the other thing. If you are not getting responses, I have a hard time if I don't know you're not getting responses, right? So if I'm going on and I think, that I've moved something on and an answer is given, like Floyd, who was on the phone earlier, like he, will check back in, and we have checked back in, back and forth. Otherwise, I assume that everything's working as it should. I don't assume that it's not working. So
we don't have any way of knowing, is my point, and neither, it appears, does the board, that the board services unit gets the questions and answers them. So maybe what we should be
a
looking
process
at,
of saying, hey, we've gotten your question and somebody will get back to you within X amount of time. Is that
right? It would be
Okay,
good if that
okay.
could be built into the system.
Okay,
It would help
I
you.
misunderstood. Yes,
It would help you, and it would help
absolutely.
all of us.
Absolutely. Yeah, I can get something like that instituted. Absolutely. I misunderstood you, and I'm sorry, Deb.
No, thank you for your time. I appreciate it.
Oh, absolutely. Thank you for bringing it up.
Okay, Peter, you're next. Go ahead and come off mute and ask your question.
Can you hear me?
We can now, Peter.
Okay. I live in Rochester, New York, my wife and I, and we have United Healthcare Medicare Advantage.
Mm-hmm.
And my wife, I'm the primary on our policy, and my wife is, obviously the secondary. She received a letter from the University of Rochester Medicine, which is the doctors and hospitals that we go to, and we
Mm-hmm.
have for 3 years now. She just received a letter in the middle, right after the open enrollment, and the letter from UR Medicine said that some United Healthcare Advantage plans were no longer going to be uh, paying UR Medicine, and that we need to make sure that our plans are appropriate. And they offered other suggestions like, Blue Cross Blue Shield and things. So then I contacted United Healthcare, and they know absolutely nothing about this. And the letter that my wife received, actually it was an email, specifically said Monroe County, New York, which is where Rochester is and the suburbs around it. Well, I contacted United Healthcare. They knew absolutely nothing about it. They told me I needed to contact CalPERS. I did speak to somebody at CalPERS, and they said I needed to contact United Healthcare. So all I'm doing is getting a runaround, and I
You're
did.
going in a circle jerk.
Yeah, I did call UR Medicine directly and asked them about this. I said, I said, I'm hoping this is a scam, because number one, why did my wife receive it and not me? And
Right.
number two, something this important should have come in a letter and not in an email. And then and this was a what do you call it? Secure message on our portal.
Uh-huh.
So I actually sent him an email, and gave him the information that they had provided, in the email my wife got. And all they did respond right back with the same information that my wife's email was, that United Healthcare Medicare Advantage was no longer going to be paying UR Medicine after January 1st. So all I'm doing is getting a runaround, and I don't know where to go.
Okay, so let me find out. I do remember reading in the paper that UHC was getting out of some of their advantage plans. So let me find out and see what I can get posted about our members when they're in that. What's going to be the recourse for our members?
Okay.
So let me find out, Peter, and we'll get back to you, and I'll try to make sure that we do that in our Q&A also, Simone, when we
Okay.
send that
You
out.
got it. Mhm.
All right.
All right. This is probably my fourth webinar I've attended, and I thank you so much for these. These are so helpful.
Oh, well, thank you, Peter. I like them too. So, yay.
And where will I find the information when you put it? Will it be an email or on the web, just on the webinar notes?
Yeah, it'll be on the Q&A, but let me find out. I'm not clear where it's whether they'll send out, our healthcare team will send out a separate email. Let me figure that part out. But let me find out the answer, because you're not going to be the only one. And so I
Okay.
feel like we have to be proactive at getting something out for our members.
Yeah, and the only problem is, well, it's going to be a problem. We've had United Healthcare now for a year, Medicare
Right.
plan, but the problem is it came out right
Right
after
after open enrollment.
Yeah.
Right. Right. I got
Okay.
it.
All right.
All
Well,
right.
thank you very much.
All right.
So Yvonne, we have 6 minutes. I know you had some closing
Right.
comments you wanted to make. Did you want to take any additional questions, or do you want to close now?
No, I want to close now.
You
And
got
so I
it.
apologize. So I do want to say I appreciate everybody that gets on and with the questions and comments and everything else. I really do appreciate you. I want to say that we are not going to have a call in December. It's just hard at the end of the year, a lot of things going on. And I'm trying to work out a schedule that it will be like a static schedule that we'll know for all year long. And as soon as we get that, we'll get that sent out. But my thinking is that, we definitely won't do December. And I've tried to do it every other month, but it doesn't work out as evenly as I would like. So, but we'll put out a static schedule. Since I won't be talking to you in December, I just wanted to, just say that I appreciate the fact that you guys have put your trust in me as your representative. I don't know if I say it enough, but I really appreciate you giving me this opportunity. There are some of you that, call me and we talk, and I appreciate that too, even though sometimes we go down rabbit holes when we're talking. I just appreciate you guys. We're going to continue to do these webinars. I think that they're a good way for us to stay connected to each other. And so, again, I just wanted to give my gratitude and share one thing that I do every year in December, which sounds kind of crazy, but I'll tell you why I do it. So I write my obituary every December. And the reason why I do that is I like to, I write it out and everything else. Sometimes it's serious, sometimes it's not. But it gives me an opportunity at the end of next year to go back and reflect and say, hey, did I hit these things that I said I wanted to be remembered by about me? Sometimes I do, sometimes I don't. I do more times than I don't, but it's a good way for me to hold myself accountable. So I just thought I'd just share that with you. And I hope everybody has a great Thanksgiving, good Christmas, and I will talk to you all in January. Thanks, guys.
Bye-bye. Thanks, Yvonne.
Bye.